Hi guys, my name's Bree. I'm doing my video on cancer. Cancer affects many people in the US health-wise and emotionally. Today I'll be asking some people questions about what they know about cancer. The National Cancer Institute stated that in 2020, about 2 million new cases of cancer will be diagnosed in the US and about 600,000 people will die from the disease. This shows how cancer really affects people. Even though cancer is such a scary thing and affects many people, there is still a lot of medicine that has evolved in helping to treat cancer. In 2019, there were about 16.9 million cancer survivors. There are many clinical trials that have been done, and by having these, it helps to gain more information on treatments for cancer. Okay, I'm here with my teammate Kylie. She's a nursing major, and we're going to be talking about cancer. So, what is cancer to you?
So cancer is the division of abnormal cells that can metastasize and spread throughout the rest of the body.
Why do some people get cancer and not others?
From poor health choices, it could be from genetics, like if someone in your family has cancer, then they can spread it to their family, but there's tests that can be done to see if it's through genetics or if you get it on your own.
Right. What are some factors off the top of your head that promote cancer growth?
Smoking cigarettes, alcohol use, radiation from sun. So to prevent it, you would want to use sunscreen and not smoke excessively or drink excessively.
Do you know any symptoms of cancer?
If you have like tumors, you can feel lumps or like weight loss.
Right. Okay. Thank you. So I'm here with my friend's mom, and we're going to be talking about cancer. She works at Crozier Hospital, which is a hospital in Pennsylvania.
Hello.
So what is cancer to you?
Well, cancer is the uncontrolled division of abnormal cells, which unfortunately can be found in any part of the body. It's usually caused by changes deep within a cell, one cell. It starts in the cell's DNA. The DNA, for some reason, is changed. We know of some causes that can change some DNA, sun exposure, but other cancers we don't know why some people get some cancers. There's some genetics involved, but what happens is the cell's DNA is genetically changed, and then that bad cell continues to divide uncontrollably and then take over that organ. Okay. If that makes sense.
It does. What are some factors off the top of your head that promote cancer growth?
Well, I guess that would be like physical and chemical agents. Is that what you mean?
Yes. Yeah.
Okay. The number one culprit we all know is smoking.
Right.
If you smoke, you most likely are going to get cancer. Actually, there's a lot of cancers are being caused by just the American diet. A lot of colon and rectal cancers we're seeing because Americans eat such a poor diet. Then also you have your alcohol abuse. So some patients are suffering from liver cancer because they drank too much.
Right.
But other people get cancer, they get it genetically. The number one cancer in America is breast cancer, and you are just unfortunately predisposed due to your genetics. So
Right.
If your mother had breast cancer, you most likely are going to get pre-screened.
Right. Is there any way cancer can be prevented?
Some cancers, yes. Lung cancer can be prevented by I don't know if it can be prevented by not smoking, but your chances are dramatically decreased.
Mm-hmm.
Using sunblock,
Mm-hmm.
you reduce the risk of skin cancer. Eating a healthy diet, whole foods, staying away from your processed foods. Processed and fried foods are terrible for our gut. So eating more whole foods and getting more exercise.
Right.
Also, the people that are just sick all the time, people that are constantly sick have a bad immune system, and they are not able to fight off the cancer cells. Like, our body has white blood cells that will fight off the cancer, but if you are just constantly sick and run down, your body's not going to be able to fight it off.
Right. Okay, what are some symptoms of cancer?
Some symptoms of cancer, patients come in and report that they have a recent dramatic weight loss. They can lose 40 pounds in, like, say, a month, and they're not even trying. That's a big one. But if you have fever or fatigue, just unexplained, no energy out of the blue, definitely a change in your bowel pattern. If you can't go to the bathroom, you may have a blockage in your colon. So a lot of people come in with what's called a small bowel obstruction. It's when the tumor is in the colon, and it causes the colon to either turn upon itself or to just stop all motility, and it just stops moving because the tumor is in the colon. So we get a lot of small bowel obstructions. If you have unexplained pain in the same spot, like on your side, that could be liver cancer. Skin, you always want to check your skin. If a mole changes at all, I mean, if it gets black, you definitely want to have that checked out. Any uncontrolled bleeding, if you're postmenopausal, meaning you shouldn't be bleeding anymore, and all of a sudden you start bleeding or have some type of discharge, you want to get yourself to the doctor and get a pelvic exam. Always get your labs checked once a year. A drop in a hemoglobin result can just trigger a test. That's how one of my family members was saved. He went and had a simple CBC lab drawn, and his hemoglobin had dropped. They ordered a CAT scan, found out he had colon cancer. He went through with surgery, and now he's cancer free. So a simple blood test and just making sure you do that yearly can prevent trouble.
Yeah.
All right.
Thank you.
You're welcome.
This is my teammate Caitlin. I'm going to be asking her some questions about cancer. What is cancer to you?
To me, I believe cancer is just like a disease. It affects a lot of people around the world.
Right. Have you had any personal experiences with cancer?
My aunt actually had breast cancer. I was a baby when it happened, but I know that it took a huge toll on my family at the time. So.
Right. Okay, in what ways did your aunt's cancer affect your family?
So at the time, my family had to take time out of work to take care of her. So she went to the hospital a few times, chemo. So obviously there had to be a family member with her. She couldn't do a lot on her own. So.
Right. How did it affect you personally?
Personally, with her being my aunt and just like someone who was really important to me, I was really concerned. I can definitely say there was a lot of anxiety and stuff with it.
Right.
Again, I was really young when it happened, and I didn't know much about cancer at the time, but I was really concerned with my aunt.
Right. Thank you. This is Kai again. She's going to be talking about what she does at her clinicals.
Right now, I'm at Memorial Sloan Kettering, which is an outpatient cancer hospital in Middletown, and it's a branch of the big hospital in the city. And through my experience, I've seen so much. I've been in the PACU, which is a post-anesthesia. They're able to treat a lot of different types of cancer. They have a lot of doctors, so they're able to be specific in different areas of different types of cancer. There's a lot of clinical trials that they're doing. One that I just learned about was basically they were shortening the amount of chemo someone had to get and doing radiation to get rid of the patient's tumor. Recently at clinical, I was able to be involved in an experience when a patient beat cancer. So when that happens, everybody on the floor goes to the room and the patient is able to ring a bell, and it's just really exciting for them, and it shows that they have a lot of support, and everybody at the hospital is very supportive of all the patients. Every experience for each patient is different, so if one treatment doesn't work, there's always a bunch of other things that could be done. There's different clinical trials that could be done and different chemo and radiation combinations that can help the patient.
Okay, this is my teammate Julia, and I'm going to be asking her some questions about cancer. Have you ever had a personal experience with cancer?
I have not personally, but my nephew has suffered with cancer for the last 4 years of his life. It has taken like an extreme toll on my family. Pretty much now we all like donate to all different types of cancer foundations. So cancer for my nephew started as soon as he was born. He was actually taken right away. He had a tumor in his airway, so he was actually had to be given like a trach, which is like a breathing tube through your throat. So he was on that for like 1.5 years of his life. They couldn't remove the tumor because of the location, and then once he finally got big enough to where they could go in, they were able to remove the tumor, and then he was cancer free. And then slow, like benign cancer tumors started to appear, and he had one on his, like surrounding his eyeball and near his brain. They like went in to remove it, and it like striked it, so it doubled in size, and now he is basically, the tumor now is wrapped around his cranial artery, which is like connected to your heart, so they can't go in and remove it because he'll die right away. And so chemo and radiation, he's went through chemo 4 times now, radiation twice. Nothing's working, so it's kind of just like a waiting game, and cancer is actually like taking over his entire life. So it's hard to watch. It's hard to be there for it. While my nephew was getting chemo and a whole bunch of surgeries, he had to stay up at St. Jude, obviously, and my sister, which is Dawson's mom, her and her boyfriend were able to stay actually they had like little housing areas for the parents because they couldn't be in the room with the child because of COVID and all that kind of stuff. So they had like bedrooms and like little apartments, I guess you could say, for the parents that they were able to stay in for free, which was great. But they just had to pay for the food, which is way better than paying for like a hotel or anything like that, or sleeping on the little tiny couches.